Good morning, everyone. Welcome to another segment of MedJCU. For today, we will discuss one of the available antibiotic drugs on the market called flucloxacillin. It is a type of antibiotic that belongs to the penicillin class. Join me and our medical experts, Maricar, Dorothy, and Tulaj for the very exciting discovery and learning in the world of medicine.
Flucloxacillin is an antibiotic prescription-only medication that belongs to a group of medicine called penicillin. This is not advisable to take for people allergic to penicillin. Flucloxacillin is also known as fluoxetine, flupin, and Stafilix. It is used to treat common infections such as pneumonia, osteomyelitis, skin and soft tissue, and wound infections, and during major surgical procedures such as cardiothoracic and orthopedic surgery. At 250 to 500 milligrams per capsules and 125 to 250 milligrams per 5 ml for oral suspension is given for 4 times a day, and a dosage for children is depending on the age and their weight. Flucloxacillin causes minor side effects such as nausea and vomiting, mild stomach cramps, digestive troubles, and some individuals may experience hives as part of allergic reaction.
Good evening and welcome to today's health segment. Tonight we'll be discussing the important nursing considerations when administering flucloxacillin, a commonly used antibiotic. We will also highlight the cultural considerations that healthcare professionals need to be aware of while providing care. Flucloxacillin is a penicillin-type antibiotic used to treat a wide range of bacterial infections. When administering this medication, nurses must be well informed about certain considerations to ensure safe and effective treatment. The timing and frequency of flucloxacillin administration is crucial. Nurses should strictly adhere to the prescribed schedule, ensuring the medication is administered at regular intervals to maintain therapeutic levels in the patient's system. Missing doses or administering them too closely together can affect the medication's effectiveness. In addition to these nursing considerations, healthcare professionals must also be aware of cultural factors that may influence patient care. For instance, some cultures may have specific dietary or religious restrictions that affect the patient's ability to take medication. It is essential for nurses to engage in open and respectful communications with patients and their families, to understand and accommodate these cultural considerations while considering the patient's safety and adherence to the prescribed treatment. It is crucial for healthcare professionals to be aware of these nursing considerations and cultural factors when administering flucloxacillin. By doing so, we can ensure the safe and effective treatment of patients while respecting their cultural beliefs and practices. Stay tuned for more health-related news after the break. Thank you.
Hey, I'm an antibiotic pill, so I can't fight the flu virus over there. You know that, right? What? Some people say I can? Well, they're wrong. Go tell them. Antibiotics like me, we knock out bacteria, not the flu virus. This is not my battle, and that's the cold, hard truth.
Welcome back and thank you for staying tuned everyone. I'm Dulaj and now we will have a look at the NSQH's actions and NMBA registered standards in relation to flucloxacillin medication. As we mentioned earlier in today's episode, flucloxacillin is an antibiotic used to treat bacterial infections including pneumonia, osteomyelitis, skin and soft tissue infections, infected burns and cellulitis. But did you know that it should be taken on an empty stomach without chewing or breaking the capsule? Or should you know this in the first place? According to NMBA Standards of Practice Standard Number 3.2, nurses are to provide information and education required to enhance people's control over health. That means nurses are to provide this instruction to the patient commencing on flucloxacillin and inform them that flucloxacillin can have side effects such as nausea, vomiting and diarrhea. The NSQH's Action Number 4.05 states that clinicians should take a comprehensive medication history which is documented in the healthcare record on presentation or early as possible in the episode of care. It is important because some ongoing medications such as methotrexate, warfarin and other antibiotics can impact the effectiveness of antibiotics such as fluvoxacillin. Older patients over 55 years of age and those who take fluvoxacillin for more than 14 days are prone to developing drug-induced liver damage. The symptoms of this condition include discoloration of sclera and skin, and nurses should be observing these symptoms as NSQH's Action Number 8.04 mandates documenting and tracking changes in observations to detect acute deterioration of patients over time as appropriate for the patient. Thank you, and we will see you again after a short break.
We have now a lot of information regarding the medicine fluvoxacillin, which is known to fight against bacterial infections. Its effectiveness in treating various types of infections such as skin and soft tissue infections make it a commonly prescribed antibiotic by healthcare professionals. Stay tuned for more informative discussions on MedJCU as we continue to explore the fascinating world of medicine.